So axi-cel is a CD19-directed autologous chimeric antigen receptor T-cell CAR-T product. And it was first to market to be approved in diffuse large B-cell lymphoma back in 2017. It also recently, earlier in 2020, not axi-cel, but the similar product, Tecartus, had indication in mantle cell lymphoma, and the research has been ongoing in indolent lymphomas, including follicular lymphoma and marginal zone lymphoma. So at this ASH 2020, I was thankful to be able to be involved with ZUMA-5, which is a phase 2 study looking at axi-cel in patients with relapsed refractory indolent non-Hodgkin lymphoma. So this included patients that had both follicular lymphoma and marginal zone lymphoma. And the approach of using CAR T-cell in indolent lymphomas is appealing, because compared to aggressive lymphomas, though not always, the relapses are typically a little more indolent, and long-term cure in indolent lymphomas is still uncommon. So hopefully, with using this novel cellular therapy approach in follicular and marginal zone lymphoma, we would be able to potentially in the future provide, maybe a curative intent option for patients similar to what we're hoping we're seeing in diffuse large B-cell lymphoma. So this was the primary analysis that was presented at ASH. And in terms of all patients with a median follow-up of 17.5 months, the overall response rate was 92%, with a complete response of 76%. And this was for 104 evaluable patients with indolent lymphoma. Looking more specifically at the follicular lymphoma subgroup, which included 84 patients, so the majority of patients, the overall response was 94%, with 80% of patients achieving complete remission. For marginal zone lymphoma, there were 20 patients included in this analysis, and the overall response rate was slightly lower at 85%, with a complete response rate of 60%. It's notable that on independent review committee evaluation, about 15% of the marginal zone lymphoma patients were deemed to not have measurable disease. So they were deemed to have measurable disease and appropriate and enrolled in study for the investigator, but when doing the analysis on the independent review committee, they were deemed to have not have measurable disease. So those patients aren't evaluable in this analysis, and it may be in some ways artificially lowering the overall response and CR rates for marginal zone lymphoma. So it's a little bit harder to interpret the data for that subtype of indolent lymphoma at this time. But duration of response seemed durable. So with the 12-month estimated duration of response, 72%, a 12-month PFS estimated at 74%, and overall survival at 12 months estimated at 93%. It's an encouraging treatment for patients with indolent lymphoma. Of course, further follow-up is needed to determine if this is maybe potentially curative for a subgroup of patients.